All right. Thank you everyone for joining our very first virtual/remote 2020 and 2021 doctoral graduation. We want to thank the family and friends who are here celebrating with their graduates. And we'll also hear some welcome remarks from Dr. Halkitis.
Thank you, Dr. Valera. Thank you everyone for being here on this memorable day. And let's hope that next year we're actually going to be with each other, and it looks like we are. I just wanted to make some remarks with you this morning. This afternoon, first of all, graduates, family, friends, and colleagues. Let me tell you what a pleasure it is for me and an honor it is for me to be with you here today to celebrate the conferral of these highest degrees bestowed by the Academy. You know that the science we enact, whether it be in schools or hospitals, in community agencies, or in more traditional labs, on the web, in a blog, or an academic journal, the work that you do is based on the science of social justice. For example, like your mentors, you recognize that the problems we face with obesity in our country is in part directed by the lack of access to fresh fruits and vegetables in one's neighborhoods. You understand that public health intervention programs rooted in health equity, empowerment, empathy, and that honor, diversity, and inclusion can bring about change and guide those challenged by health behaviors, such as drug addiction, more than education alone. You can decipher how a social network can ignite the spread of a virus like SARS-CoV-2. You are leaders who know that two children born in the same year, in the same month, and on the same day in the very same city, even within blocks of each other, may have radically different opportunities simply because one has less social and economic capital than the other. And all of this leads to the health disparities we seek to eradicate as public health leaders. As you move it forward into the world, stay true to this type of work and these social justice roots. Conduct rigorous scientific research that seeks to advance the rights of all individuals and creates an equal playing field across race, ethnicity, culture, language, migration experience, gender identity, sexual orientation, and socioeconomic status. Develop programs that provide to the underserved and which recognize and empower those who remain unheard in silence, remembering always that a scientific program directed by an agenda of social justice is as impactful as any discovery in a physics, chemistry, or biolab. These are the big ideas, which will require ongoing scientific courage and belief in the Socratic ideal that the life of exploration through science within oneself and with regard to the social conditions of the world is the one most worth living. But for today, take some time to celebrate what you have accomplished, and above all, to honor those loved ones, family, friends who have helped you reach this point. In closing, let me state that it is my honor to serve has been my honor to serve as your dean the last 4 years and to travel with you on part of your life's journey. I hope, like me, you will wear your Rutgers School of Public Health badge proudly and spread the ideals of our school wherever life takes you. I wish you much success and best wishes for beautiful lives. Congratulations, doctors. Dr. Valera, I'm tossing it back to you.
Thank you, Dr. Halkitis. Today, I have the special honor and privilege to introduce Dr. Mindy Fullerlove. Dr. Fullerlove is a social psychiatrist who focuses on the ways social and environmental factors affect the mental health of communities. She is currently a professor of urban policy and health at the New School. She received her bachelor's degree from Bryn Mawr College and her MS and MD degrees from Columbia University. She completed residency at New York Hospital at Westchester Division and Montefiore and is board certified in psychiatry. With her colleagues at the city's research group and the University of Orange, Dr. Fullerlove explores the consequences of the fractures of our society and our health and seeks ways to reconnect the broken parts. Dr. Fullerlove has published numerous articles and including 6 books entitled Urban Alchemy, which is an amazing book, by the way. Restoring Joy in America's Sorted Out Cities. Root Shock, another amazing book. How Tearing Up Cities Neighborhood Hurts America and What We Can Do About It. And House of Joshua, Meditations of Family and Place. It is my great, great pleasure to welcome our speaker, Dr. Mindy Fully-Love.
Thank you so much, Pamela. Thank you all. Wow, it's a pleasure to be here, and congratulations to the new doctors. I wrote out my remarks, here they are, because this is a solemn occasion and I didn't want to freeform it. So please forgive me for reading. And I just wanted to, the title of this is For a Time Such as This. We would all agree that these are crazy times. We have been through a year and a half of the COVID pandemic, which has battered country after country, testing each nation's resources, social solidarity, and integrity. In the midst of that, we have seen the invasion of our nation's capital by white supremacists, and we have seen an outpouring of Black indignation over incessant murders by the police. And as if all that weren't enough, after 4 years of a government that refused to update the data on climate change, we have been given new facts, and they are grim. It is into this difficult world that we are sending you, and with you our hopes and dreams for all that you might do to make the world a better place. I want at this moment of sending to honor how hard it is what we are asking of you. New York City mayoral candidate Eric Adams' description of this moment was, "I believe in all my heart that this is an Esther 4:14 moment." He went on to say of himself, "God made me for such a time as this." And this is the theme of a time such as this. Adams was referring to the story of Esther in the Judeo-Christian Bible, the story of a beautiful young woman who hesitates to put her own life at risk when all her people are faced with the threat of a Holocaust. Her uncle's explanation that perhaps she was made for such a time and for such a task heartened her to do what must be done. I want to say, as you stand in this liminal space, that you are made for such a time as this. And I hope you will carry with you 3 brief pieces of advice I'd like to share. I draw from reflection on my own times. I started my research career in 1986, looking at excess risk for AIDS among Blacks and Hispanics in the United States. Just as we were getting out our studies of AIDS off the ground, community people took us aside and said, "We know that AIDS is important, but the crack epidemic is tearing us apart." Indeed, data showed skyrocketing rates of violence, STDs, children going into foster care, and homelessness. The violence made it terrifying to think of going into the neighborhoods in the grip of crack. One young man on leave from the military was killed as he entered his own neighborhood in a San Francisco housing project. As we got to know the people caught up in the crack epidemic, we learned in detail what it was like to live in the crosshairs of an epidemic. You've seen The Wire, which depicts what journalist David Simon saw on the street, and what we heard in the clinics where we interviewed people in recovery. It was the weight of life that was pressing down on people, the burden of many traumas, including the traumas of neighborhoods burned down by urban policies of disinvestment. The growing body of work on adverse childhood experiences puts into context the cost of such burdens and helps us understand the brilliant concept of weathering that Arlene Geronimus taught us. And that was just the start of my career. From my adventures, I have drawn 3 pieces of advice. The first is get very angry. When I started to study urban renewal, I asked my teacher, Dr. Herbert Aptheker, if he had any advice. He understood the kinds of vicious abuse I was about to document and advised, get very angry. Last week, I read a guest essay in the New York Times written by Dr. Richard Friedman. He said, while the pandemic has undeniably caused extraordinary stress and sadness, research on human resilience suggests that people will recover from the trauma of the pandemic faster than many believe. And while certain groups may need mental health care for the longer term, it's also true that humans' ability to overcome adversity is often underestimated, and that an overwhelming majority of people who suffer trauma will not develop mental illness, but eventually feel better. This made me furious. Here's what I wrote in a letter to the editor, which so far the New York Times has failed to publish. Clearly, Dr. Richard Friedman skipped the continuing medical education on white privilege. I know that all of you have been to that class. It is stunning that all the reports and articles on the unequal impact of the pandemic falling on an unequal society have been overlooked in this effort to reassure, quote, us, unquote, that we'll be okay. Consider only a short list of the risk factors for severe and ongoing mental health challenges among poor and minority people: higher rates of COVID infection and death, lack of public health and health infrastructure in their communities, higher risk of job loss and long-term unemployment as the jobs they had don't come back, looming threat of eviction, and especially if the moratorium is lifted without rent payment programs in place, and racist assaults. If we learned anything from the past year, it's that generalizations in a highly stratified society have the effect of reinforcing class and race oppression and health disparities. Dr. Friedman should go back to school. It was a relief to write that, just get it off my chest. So I want to say, as you go out into this very complicated world and you see horrors, don't hesitate to get angry and write a letter to the editor. Call up your colleagues, get it off your chest. It's very important to get angry at the traumas that are going on in the world. The second piece of advice is that you have to ask the right questions. That's the biggest challenge in research, I say, having been doing research since 1986, is that you've got to find the questions that are worth answering and worth asking. There's the filmmaker Barry Jenkins, who has a new show coming out today, in fact, streaming on a prominent service, based on Colson Whitehead's novel, The Underground Railroad. When he first said he was going to make a movie about slavery, people tweeted, "What? Another movie about slavery? We don't want that." So he held the focus group and asked people, "What do you think?" And some people said, "We don't want another story about all that violence." But actually, 90% of the people said, "We do want the story, but we want you to tell the whole story." So Jenkins said, "I realized that my job was going to be pairing the violence with its psychological effects, not shying away from the visual depiction of things, but focusing on what it means to the characters." And here he asked two brilliant questions. He said, how are they beating it back? And how are they making themselves whole? These are at the heart of everything, for me as a psychiatrist, profoundly important questions. So I'm a Black psychiatrist, and in my estimation, given the traumas that Black people suffer, it wouldn't be surprising if we were all completely around the bend, but we're not. Some of us are crazier than others, but we're not all completely around the bend in spite of all this oppression. And so the issue is how? How have we beaten it back? How are we making ourselves whole? There's an X factor, so that we have oppression, we have trauma, and we have outcomes that don't equal the burden of trauma. Not to say that it doesn't have an effect, but it's not equal. Therefore, what's the X factor? And that's what Barry Jenkins was looking for. This really struck me with particular force because I'm working with colleagues on a paper for Lancet on just this topic. We made a logic model which has on the left-hand side community efforts to undo oppression, and on the right-hand side, the creation of collective resistance. And we have identified 4 processes that people use that compose this X factor: sense of spirit, sense of nation, devotion to organizing, and acceptance of self-sacrifice. Anybody could say, no, that's not the right 4. My point is not whether that's the right 4 or not, but rather that when we ask the right question, that's when we really and truly make new discoveries. Now, this isn't easy because you can't solve the equation for this X factor without looking honestly at the dynamic of assault, trauma, X factor, and outcome. And you can't look at assault and trauma without feeling and without suffering. If you aren't suffering, you aren't looking, or at least that's been my team's experience. So this is very, very hard work. but it's very fruitful work. And it's the path towards really ending these health disparities and getting to a more just nation. And the third piece of advice is that I think it's very important to relish the miracles. You never actually know in the process of this work when a miracle is going to happen in front of you. But this is the story I wanted to share. One of the ideas my research team had was to adapt the family home evening practice of the Church of Jesus Christ of Latter-day Saints for use by families in Harlem. And we created a project we called Family to Family. And Family to Family held monthly reunion dinners of a set of families, 10 to 20 families. We'd meet together, we'd have dinner, and we would carry out the family home evening practice. One part of that practice is a short lesson on something that will strengthen a family. One day, I changed my mind as the lesson. The roots of this lesson were actually in a visit to the zoo I made with my own granddaughter, who thought she wanted a chocolate ice cream from the Good Humor truck, but then she changed her mind to strawberry. And then when she tasted the strawberry, she said, I shouldn't have changed my mind. So that regret at changing her mind started us thinking about the importance of what happens when you change your mind, and how it's just, you have to think about sometimes about changing your mind. So each family talked about that together, and then we shared what had come up in the discussion. And one young girl, about 6, said to her grandmother, please tell our story. And the grandmother said that what had happened was her daughter was addicted to drugs and had a baby she couldn't raise. This was her older granddaughter, who was around 12 at the time. And so she had taken this granddaughter in. When that older granddaughter was 6, there was a new baby. And the granddaughter had said, I can't raise any more children. Now, as the little girl that is listening to this story, the 6-year-old, you could see her tension when the grandmother says, I can't raise any more children, because she was the child who couldn't be raised. But the older girl begged and pleaded with her grandmother to take in her sister. And the grandmother, who was relating the story, said, I changed my mind. And the little girl who was standing at her knee burst into this beam of joy that she had been taken in by this wonderful grandmother. For all of us in the room, that moment was a miracle. And these, just the little girl's face and the family's ability to talk about it, this story of changing one's mind, the fluidity to think and rethink how to be a family with one another, that was a miracle. And all of us who were there have since shared that miracle. We remember it as a touchstone, that in the middle of the crack epidemic, in the middle of Harlem, there could be such a moment. These 3 stories are stories of processes and experiences that were in my path, and each asked me to see issues in a new way. Always hard, whether the story made me furious or weepy with sentiment. I was able to do this work because I found my heart along the way, and I learned that it could grow and grow. And I learned that I could do this work if I did it with people I loved. Perhaps I was made for my times. I am sure that you are made for your times. And so I hope that you will find your heart, grow your love, and like Esther, save all the people. Thank you.
Thank you so much for that, Mindy. On behalf of Pamela, myself, Dean Alkitis, all of us here, thank you. Very, very, very appropriately timed to these times. And a reminder for me why it was such a wonderful honor to have been able to work even just a little bit with you years ago back at Columbia. So thank you again from all of us for that. With that, I'd actually like to transition for us into our next portion of the program. And so in doing so, I would like to introduce Dr. Sarah Elnakib. Sarah Elnakib is an educator and assistant professor of family medicine or family and community health sciences at Rutgers Cooperative Extension. As many of you know, she recently completed her doctoral degree with us here in social and behavioral health science. Dr. Elnakib is a registered dietitian and earned her master's of public health degree in health education and behavioral sciences at UMDNJ, and completed her undergraduate degree in nutritional sciences at Rutgers as well. Her past experiences include managing a Head Start program across 3 centers located in Montclair, New Jersey. The broad focus of her research is the use of policy, systems, and environmental approaches to promote child health and equity and environmental stewardship, primarily in school and community settings. Her dissertation focused on food waste in the school setting and how behavioral economics can be leveraged to reduce food waste. With that, turn the floor over to Dr. Elnakib.
Thank you so much, Vincent. Thank you, Dr. Phillip, for your comments. Dean Halkitis, honored guests, distinguished family, graduates, and faculty. It is a tremendous honor to have this opportunity to address you for the 2020-2021 convocation. When I came to reflect on what I wanted to talk to you about today, I decided to start from the beginning. I want to share why I decided to pursue a degree in public health. I started my career many years ago as a registered dietitian who worked in a small community hospital in the city of Newark. Often we saw the sickest of the sick, those who could not afford to go anywhere else. I counseled patients in the med-surg and cardiac ICU floors. Often we worked with these patients who suffered from chronic diseases such as diabetes and hypertension. We worked together to create achievable goals for them to help manage their chronic diseases. Yet, despite our best efforts, they would continuously come back to the hospital with progressing symptoms. A toe infection would become a toe amputation, and that would become a foot amputation or a below knee amputation in a few months. And this reality made me realize that nutrition education was not enough. There needed to be more significant efforts to support these patients. Upon investigation, I realized that many of my patients didn't have access to the healthy and nutritious foods that they needed in their communities. In fact, most of their neighborhoods were considered food swamps by many researchers, or areas that had only unhealthy food options. This realization made it clear to me that the built environment, and along with the policies and systems that create it, can either support healthy lifestyles or hinder them. And often these policies and systems that affect our environment do not have the most vulnerable populations in mind. This is what led me to study public health. I wanted to learn about how to work upstream to reduce disease prevalence downstream, especially in those that are underserved. I chose Rutgers School of Public Health to pursue my interest in the social determinants of health and how we can support making the healthy choice the easy choice for everyone. The School of Public Health has undergone significant changes since I started. Under the leadership of Dean Halkitis, there has been a larger focus on health equity, as well as developing a public health workforce that's more diverse and inclusive. This has never been more important than it is today, with racial injustices across the US that have led us to avoidable deaths of many, especially Black men, global violence across the world, with the most recent forced expulsion of Palestinians during the holy month of Ramadan, the mass cremation of casualties in the streets of India due to the pandemic that has ravaged the globe, and a planet that's slowly dying from climate change, and yet the lack of political will to save it. These are wicked problems who need to be solved. And we need people who are unafraid to act, people who will stand up for those whose voices have not been heard, people who will bring a different perspective to the places where decisions are made. Oftentimes, Dean Halkitis notes that The Rutgers School of Public Health is putting the public back into public health. This democratization of public health education is exactly what we need right now. And in my biased opinion, I think the classes of 2020 and 2021 are those best positioned to take on these challenges. I would argue that the classes of 2020 and 2021 are the grittiest classes that Rutgers has ever graduated. That's because they would not allow a global pandemic to stand in the way of their dreams and graduated despite the challenges that the pandemic brought. I'm not saying it was easy. We all faced different challenges during this time. Some of us had to juggle working from home, finishing a dissertation, and managing kids who are learning from home, while others were stranded away from home in areas where they were collecting research or had to adjust their data collection due to travel restrictions. Yet many others had to experience the sorrow of losing a loved one due to this virus. However, with the support of our families and friends who refused to let us give up, and the advocacy of our mentors who would do whatever it took for us to finish the finish line, we were able to graduate and complete our PhDs and DrPHs. So if a global pandemic couldn't stop you, I believe that nothing can stop you in achieving your goals. But before you go off and change the world that is desperately in need of changing, I would give you one piece of advice. It's going to sound generic and overdone, but it's never been truer than it is today. And that is to stick to your passion no matter the consequences. You have a special gift that only you can give the world. You might be tempted to chase the new sexy science or change the focus of your research after a period of stagnation. However, you'll never know when the world needs your unique contribution. Take the example of Dr. Katie Carrico. She was a 66-year-old researcher who never was well-funded. She never ran her own lab. She barely made $60,000 a year her whole entire life. Yet her dedication to mRNA research was what the entire world needed in 2020. When we were racing to create a vaccine, we all relied on her research to be able to create the COVID-19 vaccine. She could have easily changed her focus when she wasn't funded, or when she didn't achieve the traditional measures of success that are widely recognized. But her dedication and passion saved the world. As graduates of the Rutgers School of Public Health, you have a unique perspective that can change the world. You have the skills, the tenacity, the ability, and to make impactful changes for so many. I know that there are incredible things in store for all of us, and I can't wait to see what you have done to achieve them. Congratulations, class of 2021. We've done it.
After giving everyone a little lecture about making sure we use the mute button appropriately, it's Dr. Silenzio who has to go ahead and forget how to use the mute button appropriately. Sorry about that. Sarah, that was wonderful. Thank you so much. The challenges that are here before you, who've come before you, apologize for creating them, but we are so glad to know that these two classes are out there now with us to carry on this. And that leads us nicely to the section of our program where we may now recognize our graduates. Dr. Valera?
Thank you, Dr. Silencio. So we're going to spend a few minutes recognizing all of our graduates today, and we'll start with Uma. Congrats. So congratulations to Dr. Uma Buren, who graduated in the environmental occupational health. Her dissertation focuses on optimizing the integrated testing strategy for evaluating skin sensation potent pharmaceutical interventions. Thank you, Dr. Buren. Congratulations. Dr. Pasanante?
Yes, so thank you. Unfortunately, Carla could not be here with us today because she's on COVID call at the New York Health Department. Carla earned her bachelor's degree at NYU and an MPH at the University of Albany. She's an epidemiologist whose interests include public health surveillance systems and their use to inform action. She's worked at the New York City Department of Health for more than 15 years and has overseen the design and management of public health data collection systems, as well as the analysis of infectious disease and vital event data, particularly focused on maternal and infant health. During COVID-19 response effort in New York City, Carla has supported activities in the Surveillance and Epidemiology Emergency Response Group, working on interview tools and conducting quality assurance of COVID-related data from New York City public schools being entered in DOH surveillance systems. Her doctoral dissertation, exploring gestational age and school performance among siblings in New York City, utilized a number of databases collected by the New York City Department of Health. Carla was unfailingly positive as she worked through a complex analysis while holding down a full-time job and a growing family. I'm so proud of her perseverance and the high quality of the work that Carla produced.
Dr. Lin? Dr. Lin, if you're trying to speak, you're muted.
Yeah, sorry. Hi, yeah, and Yanping actually is and Dr. Lu and I co-advised Yanping. His dissertation topic is two-stage clinical study design with survival outcome and adjusted for the misclassification on the predicted biomarker. And we know that this is the hard topic. Actually, is a generalization of one of our methodology we developed before, but generalized to the survival outcome is not trivial. So it's quite difficult mathematically and difficulty to accomplish it. And this is very useful in the pharma industry as well. And so he performed a very good job in this, and then we are very happy with him. And traditionally, we would have met in person to celebrate his accomplishment of finishing his dissertation and getting the degree. But because of the pandemic, we know that we are not able to meet in person, but we have this platform to recognize his achievement thanks to the school's this arrangement. We can still meet in person after the pandemic is over. And congratulations, Yanping. So.
Thank you. Congratulations, Dr. Chen. Dr. Schwander?
Yeah, hi. I'm talking about Denise Dietz, who had identified her PhD topic based on her interest in rare clinical immunological problems and possibilities to address these therapeutically as an epidemiologist in the company Biogen, where she worked while pursuing her PhD work at the School of Public Health. Dr. Demisi invited me to chair her committee as she had decided to incorporate questions about infectious diseases in this project on the impact of systemic lupus erythematosus in pregnant women and their offspring. And Denise really worked with great enthusiasm against initial considerable odds in terms of overcoming administrative layers to obtain access permits to using the clinical practice research data link, which is a longitudinal database that is representative of the UK population with records available from 1987. And it is from this database that Denise then created her analyses and PhD work, which resulted in two great papers, one entitled Obstetric Outcomes in Women with Systemic Lupus Erythematosus, and the other one assessing the risk of infection among babies born to mothers with systemic lupus erythematosus. Denise really made an excellent job and finalized her work despite dealing with significant family obstacles and going through a rough personal time as a mother of 3 children, and made the highly commendable effort to finalize her thesis in a very good way. And it's wonderful to see that Denise now works in similarly complex chronic diseases, multiple sclerosis and inflammatory bowel disease, as Associate Director of Epidemiology in the Immunology and Fibrosis space at Bristol Myers Squibb. It was really a great pleasure being your mentor, co-mentor, Denise. Congratulations and all the best going forward.
Thank you, Dr. Schwander. And Dr. Robson or Dr. Aman Strickland?
I can go first. And so Mito is not going to be able to be with us today. He had hoped to join the celebration. Like many of our students, he faced a number of challenges, including going through a series of at least 3 advisors. But it wasn't his fault. They all left, and he had to recalculate. But in the end, he did a very sophisticated look at the issues around non-alcoholic fatty liver disease, collaborating with folks at Robert Wood Johnson Medical School. Mito also, in addition to doing that, was an instructor for the undergraduate public health program at the Blaustein School, and was rated very, very highly in the courses that he taught in epidemiology. And he also ran a very large communications business back in Ohio. So he routinely commuted back and forth from Ohio to New Jersey on a weekly basis. So he did his research, he ran a business, he was a wonderful teaching assistant for the public health program, epidemiology, as well as teaching full-time in the undergraduate program. Mito did a superb job, has several very fine publications from his work, and we're very proud of him. Pamela, I don't know if you want to add something.
I think you summarized really well. Mito has been an amazing student. One of the rare students who can do his own statistics, very delve into very complex methods, and just has no fear. So I really admire his tenacity and his intellectual curiosity. It will be exciting to see where he goes.
Thank you so much, Dr. Robson and Dr. Oman Strickland. Dr. Hilkides?
Yes, so it is my honor to congratulate Dr. Kristen Krause. So I've been in this game for a really long time, this like doctoral mentoring thing for like 20 something years. And I've had amazing students and smart students and a handful of students who are game changers. And Kristen is one of those game changers. Kristen had the unenviable reality of having her mentor decide in the middle of her doctoral studies to leave one institution to go to another. Those of you who know my story know that story. And after a year of being away from each other, we decided we pretty much couldn't live without each other. And so Kristen then followed me to Rutgers. And I think it's one of the best decisions she's made for my life personally. Kristen is an incredible researcher, not only an incredible researcher, but an incredible researcher who actually recognizes the importance of taking the science and improving the lives of people. And her work on resilience in older adults living with HIV is on the forefront. In the midst of all of this, Kristen is also a deputy manager on a journal of behavioral medicine. And as if she doesn't have enough to put up with, she has to deal with me on a daily basis saying to her things like, oh, we should start another journal, which we have done together over the course of the last couple of years. I know her future is bright. She is the true embodiment of the Rutgers School of Public Health. And I could not be prouder that my first doctoral student from the Rutgers School of Public Health is Dr. Kristen Krause. So all of you who follow, you have big, big shoes to fill. Congratulations, Kristen.
Thank you, Dr. Halkitis. And Dean Charles Menafield?
Yes, it is my pleasure and certainly honored to be affiliated with the School of Public Health and to also have served as the dissertation chair for Olubukunola Oyedele. She was the firstborn child of her parents, and she set a great example for her siblings by attending a university. She received her bachelor's degree from the University of Michigan and a master's degree from the University of Toledo. She then came to Rutgers University to pursue a PhD in the School of Public Health. Her dissertation is titled Healthcare Utilization and the Association with Cardiovascular Health of African-born and US-born Blacks. Her main objective in the study was to ascertain the health outcomes, the differences in the health outcomes between US-born and African-born Blacks. Her goal, now that she's completed her dissertation, is to use the outcomes that she found in the research to improve the health conditions in Nigeria, her home country. She extends many thanks to the faculty and staff at Rutgers for facilitating her matriculation, as well as to her parents, siblings, extended family, friends, and church family. Again, it was a pleasure to work with her, and I'd like to publicly say I am very proud of you, Olubukunola. Thank you.
Thank you so much, Dr. Dean Charles Manifold. Dr. Rhodes? If you're trying to speak.
Certainly my pleasure to recognize the accomplishments of Ehab Tuppo. Ehab was a student with us for quite a long time, and I can't actually remember when he started the doctoral program. He was in the master's program first, and all that had followed his training in osteopathy and medicine, where he was maintaining a clinical practice during most of the time that he was a student with us. Ehab forged a relationship with the Cardiovascular Institute at Robert Wood Johnson and decided to do his dissertation on the evidence that public health had made a real difference in the decrease in myocardial infarctions and the improvement in coronary disease, which had been ascribed by many people to improved therapy. And he developed several lines of evidence for this. One was that the actual presentation of myocardial infarctions has changed quite substantially over this period of time, which cannot have been due to therapy, and is almost certainly due to changes in the underlying risk factors and less atherosclerosis in the community. And a second was that he matched the deaths from myocardial infarction to those people who had actually been in the hospital with MIs earlier and those who had not and had just died suddenly. And the decline turned out to be at least as large, the percentage decline at least as large in people who had never been in the hospital and therefore could not have benefited from therapy. So it was a good dissertation. He did a nice job. And he has, I think, continuing in practice now with, last I heard, at Kaiser Permanente. And I certainly want to extend my congratulations to Ehab.
Thank you so much, Dr. Robson. Dr. Katie Devine.
Congratulations to Dr. Adrienne Viola. Adrienne is an outstanding scientist and overall human being. Prior to coming to Rutgers, she earned a master's in public health from Yale and completed summer research fellowships at the National Cancer Institute. She was awarded an F30 grant from the National Heart, Lung, and Blood Institute to conduct her dissertation research that focused on empowering young adults with sickle cell disease to successfully transition from pediatric to adult healthcare. Since completing her work in 2020, she has returned to the Robert Wood Johnson Medical School and is actually attending this event from an on-call room. So hope everything's going well, Adrienne. She will soon be a physician scientist and we expect great things from her future. It's been my honor and privilege to serve as your mentor, Adrienne. Congratulations again. I'd also like to take a moment to honor the memory of Dr. Elliot J. Coops. Dr. Coops served as a mentor to Adrienne and many others at the School of Public Health. He was a gifted behavioral scientist and a loved and respected colleague and mentor. His legacy will live on through his scientific contributions and the gifts he has given all of us. Thank you.
Thank you, Dr. Devine. And now we want to congratulate the class of 2021. And we'll start first with Dr. Sarah El-Nakib. Dr. Robson?
So Sarah, you're such a rock star. I was just so proud of you when you made the presentation a few minutes ago, and I watched the faces. That's the wonderful thing about Zoom. You know, you get to watch all your colleagues and to see the look of enthusiasm on the dean's face and all of my colleagues' faces just made me so proud of you. And so Sarah did a really interesting project. And so she is a faculty member in our cooperative extension program at Rutgers. Rutgers, you know, is the land grant school, and it has three parts at SEBS. It has a research, teaching, and extension. So she is a faculty member in Passaic County. She is literally out in the county working every day and making a difference every day. And her thesis project was exciting because it looked at how you can reduce school food waste. And it helps on several levels. One, it saves the school some money. Two, it points out to the school with the limited resources as what kids are eating and what they aren't eating. And finally, it made some really interesting recommendations and training for the folks that service those cafeterias on how to better deliver the healthy and safe and wholesome food to the kids. As you know, it is many cases, especially in our urban areas and our urban centers, where that school breakfast and that school lunch might be the only two wholesome meals that these young folks have. And so it's critical that it's the right food choices. And so Sarah is really on the front lines looking at this. And one of her papers, Process Evaluation of Smarter Lunchroom Movement Training for Elementary and Middle School Cafeteria Workers, I had to write that down so I got the whole title right, is really going to be a good paper that's going to make some significant, I hope, impacts on the folks that manage these, whether it's the school superintendent or whether it's the folks that are actually manning the lunchroom. So Sarah, your work has significance from a public health perspective. It has meaning as a health scientist. And most importantly, it makes us so mindful of the impact that Rutgers has in the lives of not just the 71,011 people that go to school here at Rutgers, but the 9 million people in the state that we serve. We are proud of you. You've done such a great job. You've had plenty of speed bumps along the way, and you've laughed at each one of those and just sprinted right past them. And like several of our doctoral students, you also were raising 2 kids because we got to meet them through the Zoom meetings as well. And we're just awful proud of you. And so what a great way to end Ramadan. What a great way to celebrate your graduation. Eid Mubarak. I'm so proud of you. Congratulations.
Thank you so much, Dr. Robson. Dr. Michael Guzmano.
Thank you, Dr. Valera. It's a great privilege to congratulate Kayamisha Evans on the completion of her DrPH. Kayamisha's dissertation looked at the reasons that the mothers of Black adolescent males gave their decisions about HPV vaccination. In doing so, Kayamisha reinforced some things we already know about the importance of physician recommendations and identified some really helpful and useful ways that we can improve communication. But I think the most significant finding from her dissertation, and in many ways the most sobering, going back to the remarks of Dr. Fullylove at the beginning, is that it's extraordinarily difficult to improve vaccination rates or really to improve the public health or overcome other forms of collective action in an unjust society. Structural racism has undermined the trust that many of these moms have in government, in industry, and in the healthcare system. So they were far from ignorant about HPV, but rather skeptical that these institutions had the best interests of themselves and their families and their sons in mind. And so while she offers up some helpful short-term things that we can do in public health, I really see her work as offering up a challenge to all of us to produce a more just society and to recognize the consequences of living in one that is unjust. On a personal note, like so many have already said about other doctoral students, Kayamisha had to overcome a number of obstacles, not the least of which was the retirement of her original mentor, a number of significant personal obligations to juggle with school and work. She had to put up with me and she had to finish a dissertation in the midst of a global pandemic. So I'm just extraordinarily proud of her. Congratulations. I'm so glad that you're not only my former student, but now my colleague. Thank you, Dr. Valera.
Thank you, Dr. Guzmano. Dr. Pamela Oman-Strickland?
Hi, Nan, congratulations. Nan G, now Dr. G, has done an amazing job looking at the associations between exposure to traffic-related air pollutants and changes in fractional exhaled nitric oxide in children with asthma. This was looking within a community, urban community of disadvantaged youths. So this work is very important in terms of understanding the environmental justice side of public health. It was my privilege to be on her committee and to work with her as she really mined mountains of messy environmental data as well as the health data from the children that were included in the study. And she really did just an amazing job. I have comments from Rob Lambach for her. So I'm just going to read those. He writes, Nan, I am sorry I cannot be there in person to give you my heartfelt congratulations. I would also like to send a warm acknowledgement to your family and friends whose support has meant so much to you over the past several years of hard work. I know that you would agree that the road that has brought you to this day has been so challenging in so many ways. Remember how soon after we met, you learned that your primary advisor was leaving the School of Public Health. This seems to be a common theme. You suddenly found yourself looking for both a project and an advisor. I'm so glad that you found me, writes Rob, and that I had an opportunity to watch you grow into a talented, capable young scholar. You have become a trusted colleague whose work ethic, positive attitude, kindness, and commitment to excellence in all that you do have always exceeded expectations. I'm looking forward to closely following your career development through your postdoctoral fellowship at the University of Southern California and beyond. Nan, dream big and set your sights high, and know that your character and proven perseverance will see you through to well-deserved happiness and future success. But for now, take a deep breath and savor this moment. Nan, congratulations, and I agree with all of that.
Thank you so much, Pamela Oman-Strickland. Dr. Pasanante.
Thank you, Dr. Valera. I'm very happy to be able to just say a few brief remarks about Maeve Loprieto. Dr. William Halpern was the dissertation chair. Unfortunately, he could not be here today, but I offered very quickly to be the person to speak about Maeve. She's a very impressive graduate of our program. And I'm just going to mention a few things about her, what brought her to public health. She started as a graduate of Seton Hall University's College of Nursing. After graduating, she worked with geriatric and rehabilitation patients in subacute and long-term care settings in New Jersey. Then she pursued her MPH from Rutgers. So I've known Maeve for quite a while. And in that, she did address differences in preventive screening for colorectal cancer among New Jersey residents. At that time, she was working at the trauma division of the Department of Surgery at New Jersey Medical School on projects related to pedestrian safety, firearm injury, and hospital-acquired delirium. And I had the pleasure of working with her with the people from the Department of Surgery and publishing with Maeve. And she's truly an impressive researcher, even before she started her doctoral degree. In 2014, she joined Kessler Institute for Rehabilitation in the quality management field, using her quantitative skills that she learned at Rutgers to approach patient safety and performance improvement in an inpatient setting. Her work at Kessler has covered falls reduction, identifying patients at increased risk for an acute care transfer, and throughout 2020, the COVID-19 prevention and response. So all of that background in nursing and acute care, she returned to Rutgers in 2015 to start her PhD and was able to blend those experiences from the inpatient setting into her doctoral dissertation to address disparities in stroke care using an inpatient quality registry. Maeve's dissertation research is really quite remarkable, and it has a potential to really make an impact on stroke care in New Jersey and beyond. So congratulations, Maeve.
Thank you so much, Dr. Pasanante. Doctors Petra Clifford and Christine Davis.
Okay,
Yes.
this is Chris Davis. I guess I can go first if you like.
Yeah, I was just going to suggest that. Go ahead, Chris.
Okay. I wrote a few notes about Sue Young because I had spent so much time with her in the past few years working on our research study. I first met her when we were training a small group of doctoral students to work as research interviewers on our newly funded alcohol use disorders treatment research study. I must say Sue Young seemed a little apprehensive during this training. We talked about interacting with study participants. However, there soon was no trace of any nervousness or uncomfortableness once we were recruiting and she began meeting and interviewing these people. She was professional but personable, laughing with participants when they were happy and listening to them talk when they needed to, all the while collecting the data we needed for our research. We promoted Sue Young eventually to the position of research coordinator, where she was responsible for the training of newly hired research interviewers and monitoring their progress. She also took over the responsibility of overseeing all the daily activities of the study when I had to be out on medical leave. I also served on Sue Young's dissertation committee as her data analysis advisor. And this experience turned out to be not only a mentoring one for me, but also a learning. Scott determined what would be the best statistical, which she performed skillfully and successfully. And the two of us also attended a couple of statistical workshops to hone both our skills on new methods of mediation analysis and multi-level modeling. And during all this work and studying and dissertation, Sue Young married and had a son. A lot to manage while pursuing a PhD. I'm thankful that I got to share in the experience with her. Congratulations, Sue Young. It's been a pleasure.
Thank you, Dr. Davis.
Best of luck to you.
Dr. Clifford?
Yes, thank you. So, as Chris said, we've worked together fairly closely with Sue Young over the years. It certainly has been a wonderful experience working with her, particularly watching her grow and develop as a health professional. Sue Young is very determined. She is very compassionate and very caring. She interacts with people in a wonderful kind of way, particularly during difficult times. The people we work with are suffering from alcohol and other substance use disorders, and oftentimes by the time they come in for treatment, they are in the more severe range of these disorders. And having someone who can be as compassionate and caring as Sue Young is very helpful for these individuals. So watching her grow and develop as a health professional has just been a wonderful experience. I am pleased that I had the opportunity to serve as your major professor and mentor. And I'm looking forward to continuing to work with you to turn your dissertation into some peer-reviewed publications. You've done an excellent job with the dissertation, and I think it's going to be a well-received paper, or papers rather, once you publish them. So again, congratulations, wishing you the best. Looking forward to continuing to work with you. And Chris and I will soon be able to get together with you and we can celebrate in person. So thank you.
Thank you, Dr. Clifford and Dr. Davis. Dr. Shoen Liu?
Hi, it is my great pleasure to congratulate Wei. It is wonderful to work with him. When Wei came to Rutgers, he actually started as a master's student at our Biostat MS program. At that time, I worked as his advisor and directed his MS capstone paper. Then Wei entered our PhD program. We worked together again and started to dive into the big data and went on the journey to develop new stat methods to analyze huge amount of data, specifically cardiovascular multivariate survival data with colleagues at Rutgers Cardiovascular Institute. Wei's dissertation research is about developing a divide and combine approach to deal with extremely large volume of data to facilitate easy and efficient computation and result in estimators through regularized estimation procedure that has useful properties to enable statistical inference and practical use. His first paper has been well received and published in the Journal of Biometrics, one of the top stat journals regarded by the stat community. I remembered that by the time when Wei finished his master's degree, he became a father of one. And but when he is working on his PhD dissertation research, he became a father of two. It's a real pleasure to witness that Wei has grown professionally as a statistician, and it's also a great pleasure to see him to develop personally now as a loving father with a lovely wife and two beautiful young boys. I wish Wei continued growth and success in the years ahead of him. Congratulations, Wei, and to your family.
Thank you so much, Dr. Shou and Lu. Dr. Irina Garova.
Hi, it's my distinct pleasure to congratulate Jessica Weaver on her accomplishments. I remember the day that Jessica actually came to our department, starting her dissertation, telling us that she was really interested in the issues of the mental health. So her dissertation looks basically into the question of how the Affordable Care Act impacted individuals with serious psychological distress. And as you probably all may know, the individuals with serious psychological distress are significantly more likely to be uninsured or covered by Medicaid. They are less likely to have private insurance than individuals without the psychological distress. Also, individuals with psychological distress likely to have worse health status and greater healthcare need relative to people without such issues. And they also have greater barriers of accessing healthcare. So we know that the Affordable Care Act really significantly reduced uninsured rates in the United States. And that includes, of course, the people with psychological distress. So what Jessica did in her dissertation, she examined the changes in the health insurance, in the healthcare resource use, in the barriers to healthcare among the people with serious psychological distress during the time frame of the implementation of the Affordable Care Act. And in her results, I guess, are basically twofold, because on the one hand, she finds that indeed the Affordable Care Act had significantly, met some of the needs among the population with serious psychological distress, especially in terms of getting them insured, with getting them covered by the health insurance. But at the same time, in her dissertation, you can see that she demonstrates that there are some limitations to the ACA in terms of actually improving the access to care, kind of going beyond just, giving the people the health insurance. So congratulations, Jessica. I guess some of the other students, it wasn't an easy journey for you. You had two children actually during this time period that you had you have written dissertation. Great job. Congratulations. Again, very happy to have served as your advisor.
Thank you, Dr. Garova. And on behalf of the School of Public Health, congratulations.
Pamela,
Yeah.
this is Junyan Hao.
Hi.
Yeah, I'm sorry I missed my congratulations to Uma because the first one I didn't notice the unmute, so that's why I think that you probably just change to next one.
So would you like to
Yes,
say
yes.
some
I
remarks?
just use maybe less than one minute because
Okay.
I don't want Uma feel like discriminated. All the students get congratulations from their advisor, but she didn't. So I don't want to make any comments about her research. That's great. About her great personality. You know, every committee member really like her. All I want to say is, you know, Uma is, I think is very unusual when being an Asian wife, Asian mother, have a full-time job in Merck and pursue the PhD degree. So I really feel it's a very challenge, but she made it, you know, beautifully. So really congratulations. And also another thing is she become, to me, I feel like she become a role model of her two daughters because her two daughters, little daughters, are also very enthusiastic about science. So I guess they must have found influence from their positive influence from Uma. Well, Uma, congratulations again.
Thank you.
And thank you for being with me for your thesis time. That's
Thank
it.
you.
Thank you, Pamela.
Thank you.
Thank you, Dr. Hong,
Thank
for those
you.
warm remarks.
Yeah.
So on behalf of the School of Public Health, we can now officially congratulate our class of 2020 and 2021. And I'm going to stop sharing my screen so we can see everyone's beautiful faces. And if you want to unmute so we can hear all these
Yay.
wonderful sounds of happiness, it would be wonderful. Thank you.
Yay.
Congratulations, everyone.
Thank you.
Congratulations, everyone.
Congratulations.
Congratulations, everyone.
Yay!
Congratulations.
And thank you, Pamela, for organizing such a nice event.
Yes.
Wonderful.
Thank
Thank you. So
Thank you,
we
Dr.
have
Hong.
our closing remarks, and I just want to introduce Reverend T.J. Fitzgerald. Reverend T.J. Fitzgerald is the minister of the First Unitarian Church of Honolulu. So he is calling us from Honolulu, Hawaii. In addition to pastoring a church devoted to bringing about a just and equitable world for all, he works with local community organizations and individual attorneys in the area of migration by assisting advocates and those in the migration process in various ways, from attending hearings to simply providing rides to and from the airport. Reverend Fitzgerald serves annually on the organizing committee for the Honolulu Transgender Day of Remembrance, and he is the Hawaii state organizer for the Poor People's Campaign, the movement started by Martin Luther King more than 50 years ago. Reverend Fitzgerald believes deeply in the power of one person to impact the world for good, and his recently released book, Together Again, an amazing book, Reconstructing a Life of Meaning, is the #1 bestseller in the area of faith and spiritually, among others. He holds a law degree from the University of Buffalo School of Law and a Master's of Divinity from Yale Divinity School. It is my immense pleasure to welcome Reverend Fitzgerald.
Thank you, Dr. Valera, and mahalo. Just such an overwhelming experience to hear the important work that so many of you are doing. So many thanks to the speakers, to the faculty, and to the new doctors today. It's been marvelous to learn more and more about the research and the accomplishments of you amazing graduates. There's much to be celebrating today. For those of you wondering why a minister is here before you, I just want to explain a little bit about my faith tradition. You'll find Unitarian Universalist communities doing a range of work in the world. We're among the most socially active traditions, regularly proclaiming that Black Lives Matter, countering all forms of oppression, including the world of dismantling white supremacy and superiority in all forms. And of course, concerning ourselves with matters of public health, including access to healthcare for all, work to abolish cash bail and a wider prison commercial complex. And we seek interventions that will address slow and perhaps reverse human impact on the environment. We have no creed or dogma. We seek very much to be a public religion or a public faith, available and welcoming to all who welcome all. We're not everyone's cup of tea, but we'll serve a cup of tea to just about anyone. In truth, it's more likely to be coffee, and it's probably going to be fair trade and organic coffee. Coffee is just kind of our thing. And I'm coming to you from Honolulu, Hawaii. Hawaii is the inhabited place on Earth that is farthest from any other inhabited place on Earth. It is only by these electronic means that so much of our connection is maintained to other parts of the world. And it's true that the beauty of the islands here surpasses what I thought was possible in the natural world, friends. But one of the most troubling aspects of a place of such natural beauty is the presence of the painful truth of life for so many who cannot afford all they need to live in a place like this, in a place that so many refer to as an earthly paradise. Many people I know work 3 jobs to support a family here. Roughly, there are 15,000 persons experiencing houselessness in the islands here. And the disparate impact of disease, incarceration, and police violence upon persons of color, and most galling upon those of Native Hawaiian ancestry, touch the shores of this earthly paradise as well. Though roughly 6% of our population identify as Native Hawaiian, 40% of those incarcerated in these lands claim Hawaiian ancestry. And so it gives me hope when I hear these things, when I live with these things every day, to meet and to celebrate all of you who are taking the step toward a life dedicated to alleviating the suffering of a hurting world today. The call for better researched, more compassionate, more effective, and more humane approaches to public health are literally everywhere we look today. We celebrate today the conferral of 2 years of degrees because one of the greatest public health emergencies in a century caused a year of conferrals to be canceled. And so we celebrate 2 generations, 2 waves of experts who will be set upon the challenges of educating a world, a people, a public who seem less and less interested in understanding that more and more is at stake. Part of the artistry of the practice of public health is holding the dispassionate accumulation of data, of facts, or objective pieces of reality in tension with the passionate belief and commitment to a population you will serve, whose lives you will seek to improve, whether that be a relatively small or particular population, or indeed the world at large. And this tension between observation on one hand and advocacy on the other is at the heart of what a hurting world needs today. With every increasing attack on objective truth comes an erosion of the efficacy of a range of public initiatives, and perhaps the most troubling are impacts on public health. But this is nothing new for the pioneers of your fields, friends. The great, the influential public health practitioners made careers, lived lives, answered calls to help the public see, to help the public understand something they did not want to see, something they did not want to understand. It's hard for me not to think of the famous work of Sarah Josephine Baker in these times. Dr. Baker helped a nation face the hard truth that the impact of poverty on the lives of children was more than a simple sad story. It was having real-world horrifying impacts on human life. And it was Dr. Baker who accumulated the data that showed that babies were dying from preventable causes in the United States in 1917 at a higher rate than men were dying in World War I. The accumulation of this data publicly available that was presented in this way, helped to bring about wholesale changes in the ways that New York City and then following the nation would address the care of infants and mothers. And Dr. Baker was also famous for being one of those sleuths who used data to track down Mary Mallon, sometimes referred to as Typhoid Mary, not once, but twice in New York City, thereby preventing even more deadly outbreaks of typhoid from Miss Mallon, one of the only entirely asymptomatic carriers of typhoid discovered in that period. And these cases of Dr. Baker's, in them we see the tension again. We see the particular, the address of a single case that was causing significant outbreaks of a dangerous illness alongside the universal, something affecting a huge number of individuals, causing untold amounts of suffering, the dispassionate evaluation, the particular, and the passion for alleviating suffering, the universal. Embodied in the life of this first woman to receive a doctorate in public health in the United States is the call to each one of you. Become a Unitarian. Sorry, I couldn't help myself. Dr. Baker also happened to be a well-known Unitarian because it was one of the only places she could believe and love who she loved in freedom. I had to get my plug in. But the other call of Dr. Baker's life and the lives of your colleagues, your mentors, your advisors make to each one of you is this: find the universal in the particular. Find the ways that the world community can be helped, can be healed by the discipline you choose to practice, you choose to support, you choose to profess in some cases. For it is only by this connection between what is affecting us all and what is affecting a few, between the universal and the particular, between passion and prudence, that life itself, the life we all share on earth, will be better for each and better for all. In my tradition, when someone becomes a minister, we call it an ordination. And the last thing that happens in an ordination is called the charge. It's when a senior member of the gathering gets up and tells the person becoming a minister what it is they've got to remember, what it is they've got to do in the world. So I have a charge for all of you now, and I don't just mean the graduates. Families, friends, advisors, all of us, this is a community of workers together, and we have work to do. So here is your charge, friends. A call to care for the public health is a sacred call. It is made sacred, endowed with a special trust by those who depend upon truth. To answer that call fully, you undertake today a life of meaning, a life of purpose, to dispassionately investigate causes, conditions, and complexities of individual suffering, and to passionately serve the public with the truth you find in your work and the ways you find to heal a hurting world. Heed this call with compassion and know the pain of others. Heed this call with professionalism and know the companionship of your colleagues. Heed this call with love and know the hope of humanity. We charge you today to answer this call with all you are and all you have to give. We charge you today to glimpse a world that will be better for having known you. We charge you at last today to see every face of every particular person, no matter how remote you may feel from them, as the face of yourself, as the face of us all, as the face of the public, as the face of humanity, as the face of the child. And remember, we are all somebody's child, whose very life you seek to save today. May you be granted strength in your work. May you know successes along the way. And may you share the burdens of the pains you find, as well as the lightness of the joys you know. And may your colleagues, both those present and those gone from us now, your family and your friends, may they be with you on this journey, lifting you to the greater things you are all destined to achieve. Congratulations to each one of you. Congratulations to all of you. May that ever be so. Many blessings on your journey. Aloha and amen.
Thank you so much, Reverend Fitzgerald. You know, one of the great joys of having, after several decades, given up on the clinical medical side of the equation and putting my focus into the public health aspect of my work, and doing that full time, has been the realization, which grows day by day in the past 18 months, that I really have returned home to my tribe. And it's the kind words that have been said all along the way, from Dr. Fullilove to Dr. Eleme, to all of the faculty advisors, to Reverend Fitzgerald. Every single one of you have reminded me of exactly what it is and why it is that I feel so much at home and blessed to have you all as colleagues. So thank you so much, Reverend Fitzgerald. And with that, I think we want to draw our ceremony to a close. I want to remind our graduates to please stick around for your photo ops, for our group photo purposes. Families are also welcome to stay and watch us be foolish as we take screenshots. And it will be our pleasure to keep you all in our connection now and in the future and even in the next few minutes. So thank you all so much for coming. And before closing, I do want to say one very special thank you to Dr. Pamela Valera, who really practically single-handedly organized this, with the exception of the other hand needed, which was Karen Meenan, who is also on the call with us now. So thank you both so much for all of the effort in pulling this together and making sure that we corrected the oversight of not fully recognizing and honoring our graduates for both this year and last. So thank you all very much for coming, and be well.
Thank you. And Karen is the best. Thank you, Karen.
Yes, Karen is the best.
Graduates,
Thank
please
you,
stay.
everybody. Thank you, Dean Mennefield.
Thank you, Pamela.
Bye, everybody.
You're welcome.
Bye, everyone.
Bye-bye.
So graduates, please stay so we can
Thank you,
take a
Dean
photo.
Okay, we'll stay on.
Bye, Olu.
Awesome. Do you guys have your flags by any chance?
Yeah.
That's like,
Oh, wonderful.
Hi, everyone.
Bye.
it was interesting to get the envelope.
Bye,
I know it.
everybody.
I opened it and was very confused because
Bye,
it was
Karen.
the only
Thank
thing
you.
inside.
Bye, Karen.
Bye, Pamela. You did a great job, Ben. Thank you. Thank you.
Oh, thank you.
Thank you,
Thank
Karen,
you,
for
Karen.
everything.
Thank you.
This is a team
It was
effort.
Really beautiful
right.
job. Thank
Okay, so I'm gonna go ahead and just take a couple of photos. Let me just wait. Dr. Clifford, are you planning to hang on? Dr. Rose, are you planning to stay? Let me see if I can. Okay, perfect. Che, I have a message for you. Let's see if I can. All right, I think.
Take a screenshot.
All right, there we go. I removed him, sorry. Okay, let's see. Wait a minute. You can release video order. There we go. I'm gonna just not show my video because it shows that I'm taking a picture. Okay. All right, wave your flags, everyone. Yay. Perfect.
Say now, look excited to be done, everyone.
We are. We're trying to stay still.
Officially done. Okay. Thank you. All right. So, thank you, everybody.
Thank you.
I'll share it. I'll send.
Thank you.
There's a couple of
Great.
things. We created a flip book of the graduation remarks.
Oh,
So I'll
wonderful.
go ahead and send that to you all, and then I'll send this photo as well.
Excellent. Thank you.
Thank you.
Thank
you all.
Congrats, everybody.
Congratulations.
Bye.
Congratulations.
Bye.
Congratulations to all of you.
Bye.
Bye.
Be safe.
Vince, you want to stay on for a second?
Yes, however,
Yeah.
we will have